Welcome, everyone, and thank you for joining today's OnBoard Limited Release Phase 1 question and answer session for healthcare providers and medical suppliers. For our first question, what is the process for submitting a PAR? The process starts with the provider submitting the PAR in OnBoard. When a new PAR is submitted, it will be routed to the payer on record for the claim to which the PAR is associated. This functionality will mirror what was done with the previous formulary application. An email notification, like the past Drug Formulary notification emails, will be sent to the email address in your profile when the payer has responded. Providers will receive an updated PAR in their OnBoard dashboard with the payer response. Providers can escalate medication, grant and parts, or denials to a Level 2 or Level 3 review. Can one organization with multiple providers use one account to process all requests? All healthcare providers and assigned delegates must have an individual board-assigned user ID. A single user ID cannot be provided to a provider group under a single tax ID number to be shared by the group's providers and delegates. For registration information, visit the Medical Portal Access and Administration web pages for healthcare providers. What is the process for assigning provider delegates in OnBoard? Healthcare providers will use their medical portal login credentials to access the healthcare provider administration pages to add delegated users. These users will be allowed to access OnBoard on behalf of the provider to perform functions based on their user role. Is there a process for appealing a medication PAR decision? The provider can choose to escalate Level 1 medication PAR denials or grant and parts to Level 2, the insurer's position, for review. Similarly, the provider can choose to escalate a denial or grant and part by Level 2 to Level 3, the WCB Medical Director's Office, for review. Claimants or their attorneys can file Form RFA-1W or Form RFA-1LC to request WCB adjudication review of a denial or grant in part by Level 3. Will third-party billing companies be able to create their own logins for MG2, C4 Auth, or HP1 submissions? Providers will be required to request medical portal access for employees of their third-party billing company to assign them the role of billing delegate. Billing delegates may draft and submit Form HP 1.0s. When Phase 3 of OnBoard Limited Release is implemented on May 2nd, 2022, the MG2 and C4 Auth forms will no longer be accepted by the board. They will be replaced with testing and treatment PARs. Treatment and testing PARs can only be submitted by the provider. Users with the role of a provider delegate in OnBoard can draft treatment or testing PARs. How many email addresses can one provider assign as delegates? A provider can assign as many delegates as necessary. The provider and each delegate will need their own board-assigned user ID. The provider and all delegates will receive an email or text message based upon their user preferences within OnBoard when a PAR status changes. Can a physician allow access to a pharmacy to obtain prior authorization from a medication they have sent over that is not on the drug formulary? A pharmacy or pharmacy employee may not serve as a delegate of the provider or prescriber to prepare PARs. Prescription writing is outside the scope of practice of a pharmacist or pharmacy employee. Moreover, the pharmacist or pharmacy employee does not have enough direct knowledge and understanding of the patient's clinical history and status or direct access to the provider or prescriber to appropriately recommend or provide medical justification for a PAR. Finally, it appears that such a relationship runs a very real risk of the pharmacy and the provider or prescriber running afoul of state and federal anti-kickback laws. Do providers need to submit requests for DME through OnBoard? Effective April 4th, 2022, providers will be required to adhere to the official New York workers' compensation durable medical equipment fee schedule. They will be required to submit a DME prior authorization request in OnBoard for equipment not listed in the fee schedule or listed but with the indicator that a PAR is required. DME instructions are now available on the OnBoard webpage for providers. A DME training webinar was also announced. Visit the upcoming webinars webpage for more information. Will medical suppliers be able to submit DME PARs via OnBoard? Vendors will not be able to submit PARs. Only the prescribing provider can submit DME PARs in OnBoard. Can payers partner with specific DME companies for use of equipment? Insurers may offer, but cannot require, injured workers to use a specific company for DME requests. The insurer will be required to identify two sources of obtaining the requested DME. They must be comparable to the requested item or brand and deliverable in the same time frame if they approve it for less than the fee schedule allows. If it meets this requirement, the insurer may provide the network partner details. So that will conclude today's webinar. Thank you all for participating. And we hope today's webinar helps to answer your questions regarding Phase 1 or the upcoming phases of OnBoard Limited Release. If we were not able to answer your question or you have questions following the webinar, you can email onboard@wcb.ny.gov with general questions or call 877-632-4996 for other questions. If you have not already, subscribe to receive WCB notifications where we will send all information about OnBoard as each phase approaches. And lastly, the new OnBoard webpage contains detailed training information for all phases with upcoming phases being added shortly. So we encourage you to visit those web pages today. And at the closing of this webinar, you will be linked to a survey. Your input here is greatly appreciated so that we can update our training resources, improve future sessions, and update the training guides that we develop for upcoming phases. Thank you all again and have a wonderful day.